Hi friends, I'm Dr. Rajasi, your community medicine faculty. I know you're all eagerly waiting for the previous year question discussion from FMGE in the year 2021 and 2022 June. So I have, 42 questions from 2021 and from June 2022, 24 questions. That means almost, 65, 66 questions I have for discussion. Okay, so just sit back, relax and you listen to the discussion. We'll be mainly discussing, due to lack of time, we'll be mainly discussing the other MCQs as well, which are likely to come from those topics. Okay, are you ready? Though this is a recorded session, let me tell you one more thing. I'll be available for your doubt clearance. So nothing to worry. Even if I will be, going little fast, you can see this later in YouTube. So it will be available in YouTube till your exam. Okay, so shall we start? So question number 1, this is starting from 2021. Minimum number of antenatal visits suggested by WHO. What is the answer? So let's see the MCQs from antenatal period. First, minimum number of antenatal checkups suggested by Ministry of Health and Family Welfare in India is 4. Okay, so as per Ministry of Health and Family Welfare, it is 4, whereas according to WHO, it is something different. We'll come to it. Now, which are those 4 antenatal checkups? First one, at the earliest or at 12 weeks after pregnancy is detected. Second, 14 to 26 weeks. Third, 28 to 34 weeks. And fourth, 36 till term. Each of this is an MCQ. Okay. Now, what WHO says is minimum for good quality MCH, minimum there should be how many? 8. There should be 8 minimum antenatal checkups. Okay. Which are 12 weeks, 20 weeks, 26 weeks, 30, 34, 36, 38, 40. So, all these are MCQs. So, the answer here is 8 because the question is as per WHO. Okay, moving on to the next one. According to MTP Act 2021, upper gestational age for termination of pregnancy for special category is at. For MTP Act 1971, originally it was only up to 20 weeks. But now we have a new amendment which is MTP Act 2021. According to which, see, this came recently in March 2021 into implementation, and according to the new one, they have increased the upper gestational age for MTP from 20 to 24 weeks for, not for everyone, but for special category of women like survivors of rape, victims of incest and other vulnerable women who are differently abled and minors. And what is the next newer change? Each of this is an MCQ. Till recently, it was said that means according to the previous act, it was said that is 0 to 12 weeks, you need 1 registered medical practitioner's opinion. Whereas from 12 to 22, you require 2 RMPs, right? But now, according to the new one, they say only 1 RMP need to opine up to 20 weeks of gestation. Whereas from 20 to 24, you need opinion of 2 RMPs. That's the next MCQ. Okay. Then, third, no upper limit if some fetal anomaly has been diagnosed for the fetus. Okay. What next? Now, we have extended MTP services which is available for unmarried women as well. And there is a confidentiality clause also added, like you are not supposed to, you're not supposed to open up all the details of the patient who is undergoing MTP. There should be some confidentiality. Okay. So, the answer is 24 weeks. Which among the following is a urine pregnancy test kit? Actually, this picture was not there. I only put this picture. Okay. So, Nikshay, Nishchay, free days, Nahi Pahel. It is obviously from this question you will understand because I have put an extra picture. It is Nishchay. The answer is Nishchay, right? So, what is Nishchay? What is the word meaning Nishchay? Nishchay means to confirm, right? So, as the name indicates, this is to confirm pregnancy. So, what you see here is the Nishchay urine pregnancy test kit. Then another option was Nikshay, right? What is Nikshay? Nikshay means ni matlab meaning no or nil. Shaya means TB, right? So, that is a web portal for entering all the details regarding the TB patient. So, if you see Nikshay, think about TB, and Nishchay, you think about urine pregnancy test kit. And what were the other options? Nei Pehel. Nei Pehel means, as a name indicates, Nei means new, right? New beginning, right? So, it is a family planning kit which is provided by our NHM for newly weds through Ashas. Okay, so I'm not going into the details. On the day of wedding, Asha will visit the house of the newlywed and she will, as you can see in this picture, see this is the Nei Pehel kit which contain along with so many grooming items like nail cutter, then comb, mirror, bindi. Along with all that, there will be other family planning equipments as well. Means contraceptives like easy pill will be there, then condoms will be there, so many things, and urine pregnancy test kit also will be there. So, that is Nei Pehel. And the other one, the fourth one was free days. Now, what is free days? I'll show you. This is free day. You can even expect it as a image based question. Free day is the sanitary napkin that is given under the program for adolescent girls. Okay, it's free only in name. Can you see 6 here? There will be 6 napkins inside, sanitary pads. That means one sanitary pad costs 1 rupee. Okay, moving on to the next. Number of maternal deaths per 1 lakh population is? What is the answer? Is it maternal mortality rate or maternal mortality ratio? I know C and D won't confuse you at all. It is maternal mortality ratio and not rate. Now, let's see. So, MMR, first MCQ, full form is maternal mortality ratio. Next MCQ, what is the formula? Formula is number of maternal deaths divided by number of live births into 1 lakh. This 1 lakh is also an MCQ. The formula itself is an MCQ and 1 lakh is also an MCQ. This means that when 1 lakh children are born alive into a population, how many maternal deaths are happening? Next MCQ, what do you mean by maternal death? There is a definition. Maternal death means a mother or a pregnant woman dying while she is pregnant or at the time of delivery or after delivery up to 42 days of termination of pregnancy or up to 6 weeks. Okay, these are also MCQs. Now, moving on to the next question. Folic acid dosage for women with history of first child born with some neural tube defect is? What is the answer? The answer is 4 mg. By the way, normally for pregnancy, how much is the folic acid given? Normally, IFA contain, what you give for mothers contain 60 milligram. It contains 60 milligram of elemental iron and 500 microgram of folic acid or 0.5 milligram of folic acid. Okay, and how do you give it? Antenatal, 180 tablets for antenatal and 180 tablets postpartum. Is it clear? These are also MCQs. Now, the question is, if she already had a baby with neural tube defect, then there will be some modification in the folic acid composition, which is 4,000 microgram, that means 4 milligram of folic acid. How do you give it? Beginning from first month before becoming pregnant through first 3 months of pregnancy. One more MCQ I am going to add here. Women who have had an NTP affected pregnancy should consume 400, this is 4,000, this is 400, see 400 microgram of folic acid each day even when they are not planning to become pregnant. So, we have discussed a lot of MCQs from this mother having NTD affected baby. Okay, and the normal IFA. Moving on to question number 6. This is a question from MCH as well as from national program. Which of the following are drugs used in medical abortion under RCH program? Which one? You know it. MTP kit contains 2 medicines, right? Which are mifepristone and misoprostol. Okay. Now, I will show you MTP kit. This is an image-based question about MTP kit. As you can see, which are the drugs? There is mifepristone 200 milligram and misoprostol in micrograms of 200, 200, 200, 200. That means 800 microgram. Okay. And mifepristone is taken orally followed by misoprostol per vaginally to induce contraction. Okay. This is how you give MTP kit. Next question. How long this can be given? That means medical abortion as per guideline is permissible up to 9 weeks. That is the next MCQ, up to 9 weeks. So, MTP or medical abortion is permissible This kit is given up to 9 weeks of gestation, or to be very specific, up to 63 days. Each of this is an MCQ. Okay. Moving on to question number 7. Which of the following is not true about colostrum? By the way, what is colostrum? It's a first form milk. Now, which of the following is not true is a question. It is thick yellowish in color. What do you think? Yeah, that's true. Rich in IgA. Yes, it is rich in immunoglobulin. That is true. High in protein. Yes, it is high in protein. High in fat and sugar. What do you think? It is not high in fat and sugar. In fact, it is low in fat and sugar. Okay. Now, I'll show you the picture. I have picture of 2 bottles. One contain colostrum and the other contain mature breast milk. As you can guess, this is colostrum. Okay, this is colostrum and this is mature breast milk. So, as you can see, the color is yellowish to orange and it is thick. It is thick because it doesn't mean that it has a lot of fat. It's not full of fat. Instead, it is packed with, you can remember PAC, packed. PACK. So, you can remember packed. It is packed with, P is protein, A is antibody. It is full of immunoglobulins or antibodies, and C is carbohydrate. It is carbohydrate. So, it contains large quantities of protein, carbohydrate and antibodies, and it is less in, that is the another commonly asked question, it is less in fat and sugar. Okay. Now, the MCQ is, what is the protein content of colostrum? It is, as given in your Nelson, of mature breast milk is 1.1 gram per 100 ml. And I said colostrum has more, almost 8 times more. So, it is 8.6 gram per 100 ml. So, this is also MCQ. Okay. Question number 8. What is the schedule of vitamin A for a child weighing less than 8 kg? So, let us first see the MCQs from normal vitamin A prophylaxis schedule. Here the answer is 1 lakh international unit. I will tell you why. Wait. Normal vitamin A prophylaxis schedule is, first dose is given in less than 1 year. That means at 9th completed month. And what you give is 1 lakh international unit. After 1 year, you give 2 lakh international unit. Don't you know that? And the second dose, you are giving between 16 to 18 months, which is, as I said, 2 lakh international unit. Thereafter, every 6th month, you have to give 2 lakh international unit till 5 years of age. That is the next MCQ. Okay. Now, the question is, what is the relevance of weight in vitamin A prophylaxis? This is for SAM children. Now, what is SAM children? Next MCQ. What is SAM? Severe acute malnutrition. Okay. Children who are having severe acute malnutrition, then there is some change in the criteria for giving vitamin A prophylaxis. For those who are less than 6 months, you can give 50,000 international unit. 6 to 12 months, like we said there, it is 1 lakh international unit. And 1 lakh international unit is given if the child is between 6 to 12 months or if the child is weighing less than 8 kg. That means even if the child is 2 years old, if it is a severe acute malnourished child weighing less than 8 kg, then you give only 1 lakh. Am I clear? So, if the weight of the baby, irrespective of the age, I am saying, if the weight of the baby is less than 8 kg, then you have to give only 1 lakh international unit of vitamin A. That is the relevance of this question. Okay. And more than 12 months, usually we give 2 lakh international unit provided the weight is more than 8 kg. And if there are some evidence of vitamin A deficiency, then 3 doses should be given as treatment. That is the next MCQ. And how do you give it? That schedule is, you have to give on day 0, day 1 and after 2 weeks 40. That means 0, 1, 40. You give 3 doses as treatment. Each of this is an MCQ. Okay. Moving on to next, STD kit color for lower abdominal tenderness or lower abdominal pain is, the answer is yellow. Okay. Now, let us see what are these STD kits. As you know, there are 7 pre-packed color-coded kits for treatment of STD, and in STD what you give is syndromic approach, right? Based on the signs and symptoms, the patient will be put under a particular syndrome, and for that particular syndrome you have pre-packed color-coded kits like you are seeing here. Okay, so you have white, grey, blue, red, black, yellow and green. Now, I'll show you how these kits are arranged. As you can see here, first is grey, then you have green, then you have white, blue, red, yellow and black as kit 1, kit 2, kit 3, kit 4, kit 5 and kit 6. Okay, and these drugs are not that important, but still I have shown it here, and the conditions also I have highlighted here. Now, most often you will be getting questions regarding which kit is which color. So, there is an easy way to remember. That is what you need to remember for your exam. Okay, I'll show you a simple picture. I'm not sure whether it will work or not, but for me it is working. Can you see an old lady carrying bag and two young girls carrying which are colored bags? Red and yellow bag. Now, what is your inference from this? That means only young people, young girls use red and yellow bag, whereas once you grey, that means once you become old, then you will not use that colored bags, right? Right? Now, I'll give you the mnemonic. The mnemonic is greying girls won't buy red, yellow bag. So, kit 1 is grey, kit 2 is green, kit 3 is white, then blue, red, yellow and blue. Sorry, black. So, this is how you need to remember. Okay? I hope it is clear. So, you have grey, green, white, blue, red, yellow and black. Okay? Hope it is working. Then, a person coming back from Assam is diagnosed with PF, drug used in treatment arm. Here, the key word is patient is coming from Assam, which is a northeastern state, right? And in northeastern state for PF malaria, what is the drug of choice? It is slightly different from what we are giving for other states, which is artemether, lumefantrine and primaquine. Now, let's see the other MCQs from malaria treatment. Under national program, we are giving malaria treatment for PV cases, that means Plasmodium vivax, then Plasmodium falciparum and also for combined infection. So, let's see one by one. For PV malaria, drug of choice is chloroquine and primaquine. Chloroquine is given for 3 days as 10 mg per kg on day 1, 10 mg per kg on day 2 and half of that, that means 5 mg per kg on day 3. And primaquine is given as 0.25 mg per kg for 14 continuous days. That is an next MCQ. Why are you giving it for 14 days? Because you know PV is well known for relapse. That means these hypnozoids will be hiding inside the liver. Anytime they can come out and give you a relapse. So, to kill all those hypnozoids or to eliminate completely all those hypnozoids, you are giving primaquine for 14 days. Okay. Next MCQ. How do you treat PF malaria? Drug of choice is ACT. What is ACT? Full form is artesunate combination therapy along with sulfadoxine pyrimethamine. That is that combination. So, that combination is known as ACT-SP. Okay. Now, which among this is antimalarial? It is artesunate. So, like you are giving chloroquine, here you are giving artesunate. That means artesunate is given instead of chloroquine. So, you give artesunate for 3 days. That means 4 mg per kg daily for 3 days and sulfadoxine pyrimethamine combination on day 1 alone. Is that clear? You give artesunate for 3 days and SP combination on day 1 alone. Now, what about primaquine? Here, PF doesn't have relapse. So, you just need to give one single dose. But that single dose should be 3 times more than what you are giving for PV, which is 0.75 mg. Next MCQ, on which day will you give it? You give it, see, don't try one more drug for day 1 because already you are giving artesunate, sulfadoxine, pyrimethamine. So, you give primaquine 0.75 mg on day 2. Am I clear? Hope I am clear. And for patients who are coming from northeastern states, what you see here are the northeastern states. There, we are giving ACT-AL along with primaquine. ACT-AL is artemether, lumefantrine twice daily for 3 days and then that means the whole combination is, I have the picture. See, this is that drug. Okay, ACT-AL is given for 3 days and primaquine on day 2, 0.75 mg per kg on day 2 because the patients who are coming from northeastern states have already developed resistance to ACT-SP. So, we are giving ACT-AL for them. Okay. Now, what about combined infection? For combined infection, you have to treat both. So, you have to give ACT-SP. That means artesunate for 3 days, sulfadoxine, pyrimethamine combination on day 1. And what is this is for PF, right? It is PF plus PV. That means combined infection. And what is the problem with PV? It is relapse. So, you have to give 0.25 mg per kg of Primaquine for 14 days. Is it clear? So, this is how you treat. We have discussed a lot of MCQs from this. How to treat PV, how to treat PF, how to treat PF from northeast, and how to treat combined infection. Okay. Question number 11. A child with fever, swelling in neck and testis is presenting to you. Parents giving history of 2 more children having similar symptoms in village. What will be your diagnosis? Obviously, swelling in neck and swelling in testis will point you towards mumps, right? Now, let's see other MCQs from mumps. Caused by paramyxoviridae, right? It mainly affects glands and nervous tissue, right? And patient will mainly present with pain and tenderness and swelling of parotid glands, sometimes unilateral, sometimes bilateral. Other clinical features are not only parotid gland but sublingual and submandibular glands also may be swollen. Then earache, you will be having swelling here. So, earache, pain and stiffness on opening the mouth can also be there, and it can also affect testis, that was there in the MCQ, right? Pancreas, CNS, ovaries and prostate. And it is usually a self-limiting disease. These are the MCQs from mumps. Now, how do you prevent mumps? It is a fully preventable condition. Under national program, we have MR vaccine, right? How many doses? Next MCQ, 2 doses. Now, when all will you give it? First dose, you are giving at 9th completed months. And second dose as booster, you are giving between 16 to 24 months. Okay. And it is given on a right upper arm. So, you can remember MRI. Okay. MRI means on right arm you are giving 2 vaccines. One is starting with M, that means MR vaccine, and the other is IPV. So, just remember this MRI. There are 2 vaccines that you give on right upper arm, which is measles or MR vaccine and IPV. Is it clear? So, these are the MCQs from mumps. Okay. I am starting from this slide. A 2-year-old child is presenting to PHC with fever, breathlessness. On examination, the respiratory rate was 46 per minute. And chest indrawing is also present. What is the management protocol? Child, breathlessness, respiratory rate, chest indrawing. So, the question is about ARI control program, right? And in ARI control program, the management depends upon whether there is fast breathing and chest indrawing and other symptoms, right? Like cyanosis and such things. So, chest indrawing is there. Is there fast breathing present? That also we need to see. Before that, have you come to the answer? The answer is antibiotic, give antibiotic, then immediate refer is also needed. Okay. So, let us see whether fast breathing is there or not. So, fast breathing is defined based on the age. There are 3 age categories defined, right? Less than 2 months, then 2 to 12 months, and then 12 to 5 years. That means 1 year to 5 years. And you can remember 60, 50, 40. That means in less than 2 months, if per minute breath rate is or respiratory rate is more than 60, it is fast breathing. In 2 months to 1 year, it is more than 50, and 1 year to 5 years, it is more than 40. Easy to remember, right? 60, 50, 40. So, this child is coming in this age group and it is 46. So, fast breathing is present. Then chest indrawing is also present. So, based on this, in a ARI control program, you are actually dividing the children into 4 categories, right? No pneumonia, pneumonia, severe pneumonia. And since chest indrawing plus fast breathing is present, it is coming under severe pneumonia, and in severe pneumonia, you have to give first dose of antibiotic and then you have to refer the patient to the hospital. Okay. Moving on to the next question. 13th question, a TB patient is found resistant to isoniazid, rifampicin, kanamycin, quinolone. He is categorized as isoniazid plus rifampicin is MDR TB, right? Is it MDR? No. We have few more. One is kanamycin and quinolone. So, kanamycin is a injectable, quinolone means fluoroquinolone. So, MDR plus resistance to one of the second line injectables plus quinolone is coming under XDR, right? And what is the full form of XDR? Extensively drug resistant TB or XDR. But let me tell you one thing, there is a change. This is as per the old definition. Now, as per the new National TB Elimination Program, it is said that as far as possible, patients should not be given injectables. So, from first line, second line, third line, we have removed injectables. If everything fails, then only you think about giving injectables. So, let's see what are the new definitions. XDR definition is new, but the old ones which you should be knowing, drug sensitive TB means a person who is sensitive to all the first line treatment, right? Mono means, as the name indicates, one resistant to one anti-TB drug. Multi means a person who is resistant to INH plus rifampicin, right? Now, we have a newer category known as pre-XDR. Pre-XDR means MDR plus resistant to any one fluoroquinolone is not XDR but pre-XDR. Now, what is XDR? Then you may think XDR would be MDR or RRTBs, rifampicin resistant TB plus any one fluoroquinolone plus not second line injectable anymore, because as I told you, we have removed injectables, all the injectables as far as possible from the patient. So, it is not second line injectables, but XDR definition is pre-XDR plus resistant to at least one additional group A drug, which is either bedaquiline or linezolid. So, next MCQ is, which are the drugs you have in group A category for anti-TB treatment? We have only, see, fluoroquinolone, levofloxacin or moxifloxacin, bedaquiline and linezolid. So, if a person MDR plus this resistant to fluoroquinolone will become pre-XDR plus any of this will become XDR TB. So, this is the newer definition of XDR TB. Is that clear? Your definition is pre-XDR plus resistant to one additional group A drug, which is either linezolid or bedaquiline. Hope you are with me. Okay, so what I have given you are newer MCQs which you can expect. Causative organism of Donovanosis or granuloma inguinalis. Yes, you're right, Klebsiella granulomatous. You know about it, right? It's a, as the name indicates, here it is mainly affecting the inguinal area. So, the MCQs are, it's a genital ulcerative disease by gram-negative bacterium Klebsiella granulomatous, right? It is mainly characterized by painless, slowly progressive ulcerative lesions in genitals, as you can see in this picture. Extragenital ulcers are also possible in intra-abdominal organs, bones, mouth. So, those also can be affected and is usually coexist with other STDs because it is mainly affecting the genital area. So, there is a sexual route of transmission. Next question, another very, very important question which comes almost every year. In a village, a woman of 25 years, either married or divorced, who has passed 8th standard, having good leadership qualities, are the criteria for ASHA worker. Okay, but this question is not entirely correct because there is a change in the educational status of ASHA. So, let's see what is the new criteria for ASHA. First MCQ, ASHA is coming under NRHM, right? It was actually suggested under NRHM, but now we have NHM, right? That means National Health Mission, which has NUHM and NRHM, that means rural as well as urban. So, it is coming under either NRHM or you can simply say NHM, National Health Mission, which include rural as well as urban. Okay. Next MCQ, what are the criteria? Criteria are, she must be a woman and resident from the village, married, widow or divorced, preferable age group, that is the next MCQ, 25 to 45 years. Formal education up to 10th standard is the latest criteria. Anybody can study till 10th standard, right? Then good communication skill and leadership quality. So, these are the MCQs, a lot of MCQs which you can expect from ASHA. And 1 ASHA is for, that is next MCQ, 1 ASHA is for 1000 population. Okay, 1 ASHA for 1000 population. Even now it is 4000 population. Okay, they are planning to change, but it's still 1000 population, 1 ASHA. Okay. So that brings you to the next question, who's USHA then? USHA is for, I said, under NHM you have rural as well as urban. So USHA is urban social health activities. Like you have ASHA for rural area, we have USHA for urban area. So she's coming under NUHM, National Urban Health Mission. She is for connecting urban slums and communities with the health center. So she should be a resident from slum. Then age, like I said, for ASHA, 25 to 45 years. And 1 USHA is for 1000 to 2500 population or beneficiaries. Okay. So, or if you say household wise, on an average, we usually see 4 people in one house. So, for 250 to 500 households or 4000 to 2500 people or population or beneficiaries. Is it clear? And she acts as a link between urban primary health center and slum population. So, these are the MCQs from ASHA and USHA. Absolute contraindication for copper T. Then the following is absolute. History of PID, relative. Don't you know that for copper T, there are absolute contraindications as well as relative contraindication. So, history of PID is relative contraindication. Active vaginal bleeding of unknown etiology is absolute contraindication. Purulent vaginal discharge is relative contraindication. Distortion of uterine cavity due to some congenital malformation, again relative. So, this is for absolute, this is one of the absolute contraindications, whereas all others are relative contraindications. Now, let us see what are the absolute contraindications and relative contraindications. So, you can go through this later. Due to lack of time, let me just skip through this. Relative, we have already seen. Absolute are, I'll read it, suspected pregnancy, then PID, vaginal bleeding of undiagnosed etiology, that was the answer, right? Then CS cervix, uterus, then adnexa, pelvic tumors, previous ectopic pregnancy. These are the absolute, whereas all others are relative contraindication. Okay, shall I move on to the next? Next is question number 70. All are true for vasectomy, except, that means which is not true. Immediate contraceptive result, what do you think? No, right? Permanent method, yes, it is a permanent method. This as well as tubectomy are coming under sterilization or permanent method. Contraceptive result after 3 months, that is also true. NSV, yes, NSV means, what is the full form of NSV? No scalpel vasectomy. Yes, that is also a type of vasectomy. So, what is the answer here? Immediate contraceptive result will not be there. Now, let's see what are the other MCQs. So, in vasectomy, you are cutting vast difference of both sides. And how many centimeters you are cutting? Around 1 centimeter on both sides you are cutting. Then you are tying the ends, right? And you have to advise the patient regarding certain things. First one, he can resume all the activities after 48 hours. Then, avoid cycling for at least 1 week, because that can cause trauma. Then, you should also tell him that he is not sterile immediately. There is no immediate contraceptive effect. He will not be sterile till 3 months, or that is next MCQ, or up to 30 ejaculations. These are the MCQs. Okay. So, during that time, he should be using some other method of contraception. Is that clear? So, these are the MCQs from vasectomy. Moving on to next very important question from hospital waste management. Human anatomical waste is disposed in which colored bag? You know the answer. I know you know the answer. It is yellow, because this is a commonly asked MCQ, human anatomical part, animal part. So, let us see what is the latest guideline and which are the colors. I will show you the table. Take a click of this into your brain. How many colors you see? Yellow, red, white and blue. So, what all you put in yellow? You put non-recyclable waste. That means waste items which are fully contaminated, dirty items which you don't want to use at all anymore, you put in yellow. Okay, like yellow, dirty fellow. All those dirty items which you don't want to use at all, you put in yellow, like anatomical waste, then soiled waste, that means contaminated, the one which is contaminated with blood, pus, such things, expired, discarded cytotoxic drugs, chemical waste, microbiology, biotechnology waste and blood bags, you put in yellow. So, in yellow, it is non-recyclable waste. Now, what will you put in red? In red, you are putting the one starting with R. That means recyclable waste. That is the first MCQ. You are putting recyclable waste. And recyclable means, you can remember, those which can be used again. So, you can remember RPT, repeat. That means rubber, plastic, tube items. R is rubber, P is plastic, T is tube items. So, tubes, bottles, syringes, Foley's catheters, gloves, which is made of rubber, urine bags, you put in red. Okay. Now, there could be a confusion. We have two bags. One is urine bag and the other is blood bag. So, which goes to which color could be a confusion. And there is an easy way to remember this. Shall I tell you? So simple. What is the color of blood? Red. What is the color of urine? Yellow. But they go to opposite colored bags. That means blood bag will go to yellow and yellow bag will go to, that means urine bag will go to red. Is that clear? So, they go to opposite colored bags. Then white. White means it is translucent or transparent bucket. Now, what is the purpose of keeping something translucent or transparent? You should be able to see what is inside from outside, right? So, there you are putting sharp waste like needles, scalpels, all those things. Then in blue, you are putting broken glass pieces and then metallic pieces which are taken out, or metallic implants like pacemaker, then dental implants, implants for used in orthopedics, all those things you are putting in blue. Is that clear? Okay. So, look at this. Keep this table always in your mind, because from each of this is a MCQ and you can get a lot of questions from this. And I think next question is also something similar. There were two questions last year. Yes, after doing dressing of a patient, cotton swab, I said contaminated waste which contain or soiled waste will go to again yellow. What is there to think? It goes to yellow. Question number 20. Back in UK, during plague outbreak in 14th century, ships and crews were kept in quarantine for how long? First question, what is quarantine? Is it for deceased? No, quarantine is for exposed individuals, right? It is for exposed individuals. Okay, and why do you want to do quarantine? Because you suspect that a person who is exposed to a disease, you suspect that he might be harboring the virus in his body. So, you want to confirm. Before that, you are not allowing the person to go and mix with the public. So, you are restricting his freedom of movement. You are restricting his movement. You are restricting his movement. For how long? That is the next MCQ. Your intention is to know whether this person is harboring this virus inside, right? So, you have to wait for the longest incubation period of the disease. So, quarantine is given for longest incubation period. Is it clear? That means even after waiting for longest incubation period, if the patient is not developing disease, that means he doesn't have the virus in the body. So, he can be allowed to go and mix with other people in the society. Okay, so quarantine is for the exposed person. Now, the question was that this term quarantine, this was actually introduced in 14th century when there were plague epidemics happening in Europe. Okay, so any ship or crew which were coming from plague affected area, they were detained for 40 days. They were detained for 40 days before entering any other country. Okay, so even after detaining them for 40 days, if none of the passengers or crew are developing the disease, then only they were allowed to get into another country. Okay, so word meaning 40 days, or this 40 days of detention has given rise to the term quarantine. Quarantine means 40 days. Before that, it was trending. That means it was 30 days, then they found that it is not working, then they changed it to 40 days, and thereafter this term quarantine came into existence. So, quarantine word meaning is 40 days, and these are the MCQs from quarantine. Okay. For the exposed individual, restricting the freedom of movement for the longest incubation period. So, we have discussed 4 MCQs from quarantine. Now, I will show you another image based question. I'm not sure whether you have seen this before. Here the answer is 40 days. Don't I have that? Yes, I have this. What is this? This is a flag. It is known as yellow jack. It is a flag known as yellow jack. If you see this flag hoisted on a ship, that means that particular ship is under quarantine. No one is supposed to go in or come out of that ship till this yellow jack is removed. So, this is a flag which indicates quarantine, known as yellow jack. Okay. Moving on to the next question. For a population of 10,000, sex ratio of more than 1,000 means. First question. What do you mean by sex ratio? First question. Number of dash per dash. Number of females per 1,000 males. That is the first MCQ. That means per 1,000 males, how many females are there is sex ratio. Sex ratio more means females are more than males. Sex ratio less means females are less than males. Now look at this question. Sex ratio is more than 1,000 means females are more than males, right? That means more than 50% of females, right? Now total there are 10,000. That means more than half of that. That means more than 5,000 are females. That means males are naturally less than 5,000. Logic, right? It's logic, common sense. Now we are entering statistics. It's so simple. Okay, all the questions were simple. Area covering one standard deviation on both sides of mean value in a normal distribution is, you know the answer. The answer is 68%, right? Now let's see what are the other MCQs. First one, what do you mean by a normal distribution? A bell-shaped curve. If I draw, I don't know whether it will come as a normal distribution. Yes, somewhat like this, I would say, is normal distribution. Okay, and in a normal distribution, we have something known as, if you know the mean value, that means the average which lies at the center, and if you know the standard deviation value, then you can apply something known as 3 sigma rule. Sigma is nothing but it is the notation for standard deviation. Okay, you have something known as 3 sigma rule. That is the next MCQ. What is 3 sigma rule? 3 sigma rule says that if you have mean, can you see mean here? You have mean value, that means average of that observation in the middle, and if you know standard deviation, then mean plus 1 standard deviation minus 1 standard deviation. That means mean plus or minus 1 standard deviation will include 68.27% of values in the data set. If you go for 2 standard deviation, that means mean plus 2 standard deviation minus 2 standard deviation, that will include 95% of values in the data set. And if you go for 3 standard deviation, that means mean plus 3 standard deviation minus 3 standard deviation, that will include 99% of values in the data set. Okay, this is known as 3 sigma rule. That is the next MCQ. So 1 standard deviation was a question here, but you can also expect 2 standard deviation as well as 3 standard deviation, and the name of this is 3 sigma rule. All these are MCQs which you can expect. Okay, moving on to the next. A doctor has given a picture to a patient regarding what all food items are to be taken in correct quantity. So, giving picture is very simple. It's there in the option. It is pictogram. Okay, picto means picture. So, showing picture to patients as part of education is pictogram. And another MCQ from pictogram is, this is method of presenting data to the man in the street. A very commonly asked MCQ, man in the street. By the way, who is man in the street? Not beggars. Okay, we are talking about common man. To common man, if you show a histogram or a pie chart, sometimes they may not understand. For them, the best method is showing pictures. Now, I will show you an example of a pictogram. With regard to this particular question, I will show you a pictogram. See, this is a pictogram of what all items should be taken in correct quantity when you are having food. Now, look at this. This is healthy eating plate. So, this is a pictogram. Do you agree with me? It's a picture showing the proportion of items that should be taken for a balanced diet. So, by looking at this, the person will understand, okay, I have to eat more of vegetables daily. My daily plate should contain more of vegetables. Then it should contain, what happened? Yeah, it should contain fruits. Then grains are important. Healthy proteins are important, then water is very essential and healthy oils are also essential. This is a pictogram showing pyramid, okay, food pyramid. So, these are examples for pictogram. I hope it is clear, and it is a method for presenting data to the man in the street. Ready for the next question in STAT? Very simple question. Difference between lowest and highest in data distribution, that means values in data distribution is known as, so simple. Even lower primary school child will answer from lowest till highest or from highest till lowest is, you call it as range, right? Even a common man knows about this. It is a range. So, range is difference between the highest value and lowest value in an observation. Now, what is quartile range? Let's see one by one. Quartile range means it is also known as IQR. I am not going into the details. Interquartile range. It is interquartile range. It is the difference between third quartile and first quartile. Okay, just I'm not going to tell you what it is. Just understand that you have something known as quartile, where the data set is divided into 4 equal parts. That is why you call it as quartile. Data set is divided into 4 equal parts. And the difference between Q1 and Q3. That means the first quartile and third quartile is known as interquartile range. And within interquartile range, I'll just show you in a data distribution. Okay, you are dividing it into 4 equal parts. So, you have Q1 here, Q2 here, Q3 here. Okay, and this the gap between Q3 and Q1 is known as interquartile range or IQR. And the next MCQ is within interquartile range. Next MCQ is 50% of data set in the distribution will be falling. Okay, so within interquartile range or between Q1 and Q3, 50% of values in the observation or in the data set would be falling. That is interquartile range. Next is what is coefficient of variation? Coefficient of variation is standard deviation divided by mean. This is the formula for coefficient of variation, and it shows difference or variation. Variation means, word meaning is difference. It will tell you the difference which is happening in 2 different samples. Then you have variance. What is variance? Variance is standard deviation square. It is square of standard deviation. So, variance equal to square of standard deviation. So, standard deviation equal to square root of variance. These are the MCQs that you have to keep from this particular question. Okay. These were previous MCQs. Okay. That means each of the thing that I said here are previous MCQs. Shall I move on to the next? Start over. Happy? A solution was made in front of a group of mothers for diarrhea treatment by health worker. Which method of health communication does that refer to? So simple. Someone is showing someone how to do something and people are watching. So what is it? Showing means it is demonstration. Okay, so it is nothing but demonstration. Now you know what is lecture. You know lecture. We have attended a lot of lectures. All these are various methods of health communication. These are various methods of health communication or various methods of health education. Okay, you know what is lecture. What is workshop? In workshop, everyone, including the audience, will be working. That is why it is known as workshop, because everybody will be working. So, all those who attend the workshop, including the audience, will be divided into small group, and each group will be given a small work to do. So, it is like a brainstorming session. Okay, so everybody will be working in a workshop. Role play, you know, role play we have done in our schools and in colleges. Role play. It is like dramatizing a situation. It's like a social drama. So, you are enacting a particular situation. That is role play. Is it clear? So, these are various methods of health education or health communication. And this is an example for demonstration. Okay, so someone is showing the public how to make ORS. So, they are taking, see, water and water to add and how to mix it, those things they are showing so that people can just watch it and it is learning by seeing. Okay. What does the area require for sanitary landfill for refuse disposal in a village of 10,000 population? Nothing more, nothing less. The answer is 1 acre. This is as such given in your park textbook. For a village where 10,000 people are living, if they want to do a land disposal for refuse or for solid waste, then the area required for making that trench is 1 acre. Okay, just keep this in your mind, 1 acre. Okay. Number of people required for a group discussion is? It is? Any guess? If there is a group discussion, number of ideally, I am saying ideally, the number of people required is 6 to 12. Okay, now let's see what are the MCQs from group discussion, also known as focus group discussion, also known as focus group discussion. As you can see in this picture, a group of people around 6 to 12, which is a frequently asked MCQ. 6 to 12 people will be sitting around a round table. Now, what is the purpose of sitting around a round table? You can see each other, right? You can see their expression and you can learn a lot of things. So, it's a kind of round table conference, which is focus group discussion. Here, the size should be 6 to 12, which is an MCQ. There will be two important people. One is known as a group leader or a moderator or a chairman, and he will be moderating this conversation or this group discussion. So, this discussion will be on one specific topic. Okay, and the chairman or the group leader, he will initiate and he will encourage people to talk, and finally there will be one more person, he is known as a recorder. He record all those events that are being discussed, and finally what is the agreement that is being reached. So, there are 6 to 12 people, first MCQ, second MCQ, there will be a group leader, third MCQ, there will be a recorder who will record, okay, what all others have said and what are the final conclusions. Right, moving on to the next. This is from sociology. Couple has given birth to their first child. Which phase of family cycle is it entering to? When this question came, there were a lot of MCQs. Some said it was entering to, some said it is the end. So, let's see what the answer is. Majority said this was the question. So, next question is about, by the way, any guess what is the answer here? Is entering into extension phase. So, the next question is, what are the phases in family cycle? How many phases? First MCQ, 6 phases are there in family cycle. So, let's see which are those 6 phases. You have phase 1, 2, 3, 4, 5 and 6. Each phase has got a beginning and an end. Are you understanding? Each phase has got a beginning and an end. That is why you had a question, when one child is born, which phase is it entering to? Okay. So, let's start with the first one. What is phase 1? Or a family starts with, is it with the birth of a child? No. Family starts with getting married. Okay. So, the beginning is marriage and it ends with the first child being born. So, this is the beginning. So, this is husband, wife. Okay, let us assume this is husband, this is wife, and this is the beginning of formation phase. So, first phase is naturally it has to be formation. A family is formed when two people marry. Okay, and that formation is complete with the birth of first child. Are you able to make out? So, father, mother and child. This is the end of formation. So, formation is complete with the birth of first child. Now, with the birth of first child starts, the next phase, which is extension. Are you seeing? Extension. So, from second 2, it became 3. So, it is extension phase. Beginning is with the birth of first child and it ends with the birth of last child. Suppose there were only 2 children. So, this is extension. Okay. Now, extension is complete, right? So, complete extension starts with the birth of last child with the first child leaving home. Okay. So, see, from 4 it became 3 now. Then starts, so you can see from 4 it became 3, so it is contraction. So, when the first child leaves home, that is leading to the starting of contraction from 4, 3. And the contraction is complete, or I would say it ends, that phase of contraction ends with the last child leaving home. Now, how many are left? Just 2. So, this is completed contraction. It starts with the last child leaving home with the first spouse dying. Now, just one person left. So, that is dissolution. Dissolution starts with the first spouse dying and the death of the survivor. So, it started with 2, ended with 2. Are you understanding? It's kind of, it's something that you need to visualize in your mind. It's beautiful how the cycle of family is being described. So please keep in your mind, I used to think that a family starts when you are born into a family. It is not like that. Your family begins once you get married. Okay, so that is the beginning of family. So here the answer is, it is extension, right? Birth of first child, it is entering the next phase, which is right? Let's go move on to the next 28th question. Most common cause of childhood blindness. You know it. Childhood blindness, most common is vitamin deficiency. Now I have two important MCQs regarding what is the definition of blindness as per national program and what is the definition of visual impairment as per national program. As per National Blindness Control Program, blindness is visual acuity of less than 3/60. And next MCQ, what is the definition for visual impairment? It is visual acuity between 6/18 and 3/60. Both these are MCQs. Right? Next MCQ, most common cause of visual impairment in children is, it is not blindness, something which is coming before that is refractory error. We know many children are having problem with their eyesight because of refractory error. Especially I think after this COVID, since the online classes have started, and for you people, after all those apps have been introduced, I think visual impairment, this refractory error is a big problem for everyone. Most common cause of blindness in adult is naturally cataract. So for children, most common cause of blindness is vitamin A deficiency, visual impairment is refractive error. For adults, it is cataract. Blindness is cataract. Right? Moving on to the next. 29th question. A patient from Rajasthan working in stone cutting industry. That has something to do with your thinking process. In Kota, presenting with cough, weight loss and other symptoms. Okay. Suggestive of TB. They have told you it is suggestive of TB. Could be because of which of the following pneumoconiosis? First MCQ. What is pneumoconiosis? First MCQ. What is pneumoconiosis? Pneumoconiosis means it is the occupational hazard due to respirable dust which is getting deposited in the lung between the size of, that is next MCQ, 0.5 to 3 micron. So, it is because pneumoconiosis is because of respirable dust between the size of 0.5 to 3 micron. First MCQ. Okay. Now, the question is, in which of the following pneumoconiosis? Anthracnosis is because of coal dust, right? Okay, let me complete that MCQ as well. After that, we'll come to the answer. Silicosis is because of silica, right? Okay. Bagasosis is because of, do I need to write silica? Okay, I'll write silica. Silica particles or silica dust. Then bagasosis, yes, I can hear you saying sugar cane. Bisonosis is because of, yeah, cotton. Mainly seen in milling industry. Okay, cotton dust. Now the question is, which of the following is prone to develop, which of the following of these four is more prone to develop TB? It is silicosis. Okay, silicosis, patients with silicosis are prone to develop TB, and what do you call that condition as? That is next MCQ, silicotuberculosis. It is silicotuberculosis. Are you with me? All these are MCQs. Dears, you have to keep them in your mind. Moving on to the next. It's a continuation of silicosis. What you see here is the chest X-ray of a patient with silicosis. Now, I'll show you, I hope you can see this arrow. Can you see one arrow? Or else I can show you. Can you see this? Let me take red color so it will be more visible. This one. Can you see this one? Are you seeing it? This is peripheral calcification of thoracic lymph node. Can you see a round? Peripheral calcification of thoracic lymph node. And you call this appearance that you see in silica as, it's appearing like a eggshell. Can't you appreciate an eggshell here? So, it is also known as eggshell calcification. In which other condition you see eggshell calcification? Again, something starting with S, sarcoidosis. You see eggshell calcification in silicosis and sarcoidosis. And the X-ray picture that you see in silicosis is also known as two more names. One is ball of wool appearance and another one which is commonly asked for your exam is snowstorm appearance. So, you can remember S and S. Okay. So, shell, snowstorm, all these are with S, that means silicosis. Are you able to relate? I don't want to waste my time on this because I have one more MCQ, two more MCQs in fact, from this particular silicosis. Silicosis is mainly seen in India in pot makers, as you can see in this picture, and rope grinders. In that question, it was stone cutting, something like that they had mentioned. Because mainly, this is silicosis mainly seen in, these contain silica particles, right? Silica particle is what you see coming out when someone is involved in this occupation. So, these are the occupations where you commonly see silicosis, because of which comes the next MCQ. Silicosis is also known as grinder's disease and potter's rot. I hope you have got all the MCQs from silicosis. Shall I move on to the next? Malignancy of lung is associated with which of the following pneumoconiosis? That means there was 2 questions from pneumoconiosis. Out of all this, which one is prone to develop malignancy? Don't you know? It is asbestosis. Asbestosis is more prone to develop malignancy, especially, CA bronchus, then mesothelioma and such. Next MCQ from asbestosis, it is mainly affecting the lower part of the lung, or I would say base of the lung, basal part of the lung. The type of asbestos fiber which is responsible for asbestosis is mainly amphibole. So, you can remember A and A. Asbestosis is because of amphibole, because we have 2 types, one is amphibole and the other is serpentine. The disease is mainly because of amphibole. So, you can remember A and A. And asbestosis is prone to, or patients with asbestosis are prone to develop malignancy. Next MCQ, 31. You are working as a medical officer in a ESI hospital, treating insured person is coming under. That means the question is, you are sitting in a ESI hospital and you are giving treatment to all those patients who are insured under ESI. It is direct medical benefit. So, this is giving free treatment for patients who are coming under ESI program or who are insured under ESI. You call it as medical service, right, or medical benefit. And medical benefit are of 2 types. You have direct as well as indirect. Direct means it is given through hospitals, ESI dispensaries. Indirect means, so direct pattern means directly through the agency of ESI hospitals. Indirect means there are no hospitals, but we have some medical practitioners, some private medical practitioners who are empaneled as ESI, ESI insurance medical practitioners, and you are giving service through them. That is indirect. That means there are no hospital, but we have some doctors. You also call it as panel system. We have a panel of private doctors who are working for ESI. The others are sitting inside or they are located inside a ESI hospital or dispensary. That is direct, and then you have indirect. Easy. Okay, nothing much. But this was a previous MCQ, right? The best parameter for measuring disease burden in a society is repeatedly asked question. It is DALI. DALI full form is disability, what is A? Adjusted life years. Okay. Which is a disability indicator. So, this is a disability indicator, something which indicates disability. Next MCQ, which are the disability indicators? There are mainly, I would say mainly 4 disability indicators. One is DALI, then you have HALI or HALE, health adjusted life expectancy, quality adjusted life years, and 4 Sullivan's index, also known as DFLE. That is the new name, disability free life expectancy. Okay, so all these are disability indicators. Are you with me? Next MCQ. What is actually DALI? How do you calculate DALI? There is a formula. DALI, before that, this was the MCQ. It measures the burden of disease. Which one measures the burden of disease was the question. Burden of disease is measured by DALI. Out of these 4, burden of disease is measured by DALI. And it is defined, it's a measure of burden of disease in a defined population and effectiveness of intervention. And the formula for DALI is YLL plus YLD. Now, what is YLL? YLL means years of life lost because of premature death. That means early death. How many years lost? Years of life lost. Plus, what is YLD? Years lived with disability. That means how many years a person lost because of early death and how many years he lived with some disability before dying. So, you add that and you will get DALY. So, it's not exactly how you do DALY, but at your level, please do understand it is YLL plus YLD. That is the next MCQ. Okay, all these are MCQs. Moving on to the next. This is a question from study design. A question which you can expect. Definitely 1 or 2 questions will be there every year from study design. To find out the incidence of deafness in factory workers, the suitable study designers. And 4 study designs are given: cross-sectional, case control, cohort, RCT. Here the key term which help you to find out the answer is, any idea which is the key term? Incidence. Okay, incidence you get from cohort study. Okay, so you get incidence from cohort study. Now let's see the rest of the MCQs. From cohort, which all outcome measures you get? There are 4 outcome measures that you get from cohort. One is incidence, then relative risk, attributable risk, and then attributable risk, and then you have population attributable risk. These are the 4 outcome measures in cohort study. What about in case control? Case control, the outcome measure is 1, which is odds ratio. Alright. Next question. Cross-sectional study. Now, what about cross-sectional study? Cross-section means, as the name indicates, at one point of time you are taking the cross-section of a population. And the best example is doing a survey. So, whenever you see survey somewhere in the question, always think about cross-sectional study, because cross-sectional study is done by survey. Asking about the exposure is case control. Finding out the incidence is cohort. I am not going into the details. I really want to go into the details. I feel like going into the details, but we don't have that much time. So, when you do the survey, you can find out on an average how many people are there with a disease, or per 1000 population how many people are having hypertension or diabetes or COVID. So, you call it as the outcome measure is prevalence. That outcome measure that you get from cross-sectional is prevalence. So, cross-section gives you prevalence. That means per 1000 people surveyed, how many were having a particular disease. That is prevalence. New cases is incidence. Then what is RCT? Outcome measure in an RCT is, we'll see RCT in the next question. I think next question is from RCT only. RCT is randomized control trial. These are drug trials, right? And the outcome measures are mainly 2 in number. Just remember these terms. Intention to treat analysis, and that is first one, and the second one is effectiveness of a drug, or a medicine. Okay, effectiveness or efficiency of a drug you get from RCT. Okay, how well or how good is a drug in its working. And intention to treat analysis, just keep these terms in your mind. Don't ask me what they are. I am assuming that you know it. If you have any doubt, you can ask me later. Which of the following is the best method to reduce selection bias in a clinical trial? Whenever you hear trial, clinical trial, that is the key term. Think about RCT. And what is RCT full form? Randomized control trial. And in randomized control trial, the most important thing that you do is randomization, because randomization will take out selection bias. Okay. By the way, what is RCT? RCT, I said these are drug trials. Here what you do is, I have a picture. You take a group of patients with one particular disease. You divide them into 2 arms of almost equal size. One arm is known as the treatment arm and the other arm is known as the control arm. Okay, and this division is known as randomization. You are randomly assigning them. You are randomizing them into treatment arm and control arm. To the treatment arm, you are giving your drug of choice. To the control arm, you are giving placebo. Then both are being followed up for 1 week or 2 weeks or 1 month. And at the end of this follow-up time, you are seeing what percentage of your patients who got drug of choice got cured or new drug got cured, and what percentage of Those who were taking placebo got cured, and this difference in the outcome is what you are comparing in a RCT. Is that clear? So, randomization means it is a statistical technique by which it will be decided on its own, or it's a scientific method by which it will be decided on its own who will go to treatment arm and who will go to control arm. That means the researcher, suppose I am the researcher who is doing this drug trial, I cannot decide, I cannot pick my patients into treatment arm and control arm. Instead, it will be, there is a scientific procedure by which it will be decided on its own who will go to treatment arm and control arm. If I choose, the thing is, there will be selection bias. I will be choosing only good patients who are likely to give a positive result in the treatment arm, right? So that whatever inferior drug I give, I am going to get a result which is going to favor my new treatment, right? So, selection bias will be removed when you do randomization. And randomization removes not only selection bias, it also removes, that is the next MCQ, confounder bias, and the third advantage of randomization is it will make the groups comparable. These are also MCQ. So, randomization is good to remove selection bias, confounder bias, and it will make the groups comparable. So, this is about RCT and the MCQs from RCT and the outcome measures that we have seen, intention to treat analysis and the effectiveness of a drug. Best quantitative method to study previous research studies is? Answer is meta-analysis. It is meta-analysis. Now, what is meta-analysis? Meta-analysis means here you are not taking data from the patients. Instead, you are collecting studies which were done previously in the same topic. Then you are compiling, you are bringing all those studies together, you are combining their result and you are coming with a new result. That is meta-analysis. Okay, systematically combining the results of previous research to arrive at a conclusion. And this is meta-analysis. So, you are taking study 1, study 2, study 3, study 4 which were done by few others. In the same topic, I am taking those results, I am combining that, and that result you are publishing, that becomes meta-analysis. Hope you are with me. Okay, this is meta-analysis. Next is from nutrition. A maize eater has presented with diarrhea, dermatitis, dementia. I think the answer is coming to your mind. Which of the following is a nutritional disease he is having? I think in FMGE, every year this question comes. Even in NEET, every year this question comes. I don't know why they are so obsessed with Pellagra. Okay, so this is a short question for you. Okay, now let's see the MCQs from Pellagra. Pellagra is because of deficiency of vitamin B3, also known as niacin, right? This is an MCQ. Next MCQ, which are the staple food that can lead to Pellagra? Maize was given in that question. Yes, maize is one food item which can cause Pellagra. Another is jowar. It's all the same, kind of same only, or corn. Any of this, if you find in the question, it is about Pellagra. Okay, because they are actually, it has got a lot of leucine which interferes with the conversion of tryptophan to niacin. Certain things are happening when you have a lot of maize or jowar, because of which Pellagra is the resulting disease, which leads to niacin deficiency. And the 4 Ds are diarrhea, dermatitis, dementia, and even death. There are the 4 Ds. Next MCQ. Okay. I have an image-based question from this. What is your diagnosis? I'm sure you will say this is Cassell's necklace. C-A-S-A-L. Cassell's necklace seen in Pellagra. So, that hyperpigmentation seen around the neck in Pellagra. This is Cassell's necklace. Can't you make out? See? This one. Something like this. Cassell's necklace. Birth rate and death rate is measured at state and national level by? It is civil registration system. First MCQ, what is civil registration system? Birth and death registration system. Another name is birth and death registration system. Next MCQ, births in India must be registered within births in India must be registered within 21 days. Next MCQ, deaths in India should be registered within 21 days. So, it is 21 days for both birth and death. Okay. Next MCQ is from census. Census is done every 10 years. Next MCQ from SRS. By the way, what is the full form of SRS? Sample Registration System. It is Sample Registration System, that is SRS. And the MCQ from this is, it is also known as Dual Registration System. It is also known as Dual Registration System. Dual, D-U-A-L, because two people are working in the field. So, because of which it is known as Dual Registration System. Data is collected 2 times. I am not going into those details. That is why it is known as dual registration. Next is NFHS. Full form is National Family Health Survey. It is being conducted in rounds. So, the MCQ from this is how many rounds are completed so far? The latest is NFHS 5. So, how many rounds are completed so far? 5 rounds. So, these are the MCQs from Census, Civil Registration System, SRS and NFHS. Right. Moving on to 38th question. A farmer is giving history of his wife eating bajra, having black discoloration, has presented with vomiting and allergic reaction. Which is the best way to segregate black color from bajra? Kind of tricky question. What is that black thing in bajra? It is nothing but ergot poisoning because of Claviceps purpura. And how can you remove it? That is the question. It can be removed by floating it in, it's so light, by floating it in 20% sodium. That is the answer, or 20% saline. Now, let us see other MCQs from this particular topic, ergotism. Bajra or rye in field may have, it's about food toxicants. Okay. As you can see, this is how that black fungus will look like. And this is a typical thing that you see when there is ergot poisoning in barley. Can you see these black things? These are nothing but ergot. Ergotism, it is because of ergot poisoning. Next MCQ is, I have already said, it is because of the fungus Claviceps purpura, mainly seen in rye and other cereals like bajra. It is a field fungus. We have seen in field, it is infecting the rye and other cereals. Another MCQ which came 2 years back in NEET and FMGE was, it is also known as St. Anthony's fire. Which disease is known as St. Anthony's fire was the question, which is nothing but ergotism. You know why? Because ergot contain ergotamine. One of the poison or one of the toxin which is produced is ergotamine, which can cause vasoconstriction, and the patient will be presenting with fire-like condition. I would say, hyperthermia, and the patient will be having burning sensation all over the skin. And during olden time, those people were taken to St. Anthony's church, and St. Anthony's disciples, they did something to give a remedy, because of which it is known as St. Anthony's fire, because people in olden days, they believe that only St. Anthony's disciples could cure this disease, because of which it is known as, ergotism is known as St. Anthony's fire. Okay. How can it be removed? One is floating it in 20% saline, and other things you can see in the picture here. These pictures are from NCERT syllabus in school, because this is being taught in school, how to remove this by hand picking and by air floating. Information of a biased or misleading nature used to promote a political causes, even though you don't know what it is. By common sense, using your logic, you know what it is. That means some information is directly installed into your brain. They are not allowing you to think, like what is happening in politics. You are not thinking. Somebody is saying something, you are imbibing that into your brain and you are acting. Right? It's a, all of a sudden you are acting. It is propaganda. Opposite of that is health education. So, here I have a table. If you get time, you can go through all these cells, which shows the difference between health education and propaganda. So, basically the differences in health education, you are getting an information and it is helping you to think, and finally based on your thinking, you are taking a decision. Okay, so there is a reasoning, then your self-expression is there, your personality involved, knowledge is involved, and it depends upon your attitude, behavior, skill, so many things. Whereas none of this is involved in propaganda. In propaganda, it appeals to emotion. That means, okay, you have to do this. Then finally, okay, he said, so I will do this, without thinking you are doing it. And even in ads, it's kind of propaganda. Majority of ads are also giving propaganda. There is a standard pattern of attitude. It's spoon-fed, received. Those are the differences between health education and propaganda. Go through it when you get time. Okay. Next is again something you can write using your common sense. Lowest glycemic index. By the way, what is glycemic index? You know. What is the answer? Is it watermelon, papaya, potato, apple? Which one has got? You know, it is not potato for sure, because we know that potato, we usually ask diabetic patients not to take potato, especially mashed potatoes. They have high glycemic index. So, that is even otherwise out. Out of those three fruits, which one do you think has got lowest glycemic index? Watermelon, papaya, apple. Something which keeps our profession out. Apple. An apple a day? Yes. Keeps the doctor away, because it has got low glycemic index. And this is something which is a fruit which is safe for diabetic people. So, watermelon, the glycemic index is 72, papaya 60, potato it's high, and apple it is 39, it's less than 40. So, out of these four, the one which has got lowest glycemic index was apple. Okay, moving on to the next. Two more questions left. Okay, so vitamin K at birth is given to prevent. Don't you know the answer? Vitamin K, in the absence of vitamin K, what can happen? Bleeding. So, hemorrhagic disease of newborn. Vitamin K at birth is given to vitamin K injection. The question they might have meant is injection of vitamin K is given at birth to prevent hemorrhagic disease of newborn. Right? By the way, why there is vitamin K deficiency? How is vitamin K formed inside the body? How come adults are having vitamin K? Vitamin K is produced by the gut bacteria. And what about children? They are born without any gut bacteria, right? So, and their reserves of vitamin K will also be less. That is why children are prone to develop hemorrhagic disease. To prevent which, we are giving injection vitamin K. Next MCQ. Poor man with gum bleeding is coming to you as shown in the image. This may be due to the deficiency of which vitamin? Which vitamin deficiency can cause gum bleeding? It is vitamin C. And what do you call that condition as? Vitamin C deficiency will lead to scurvy. And what are the features of scurvy? I have few pictures here which shows the features of scurvy. There will be hair loss, it can affect your skin, there will be hemorrhage or bleeding spots from gums, bleeding spots from skin, wobbling of teeth, teeth falling. These are then brittle nails. All these are features that you may see in scurvy. Now, I will show you another image-based question. What is your diagnosis? Can you see skin with something to do with vitamin C? So, are you thinking hair follicles like corkscrew? Yes, this is corkscrew hair that you see in scurvy. Okay, and two more MCQs from vitamin C. Of all the vitamins, the most sensitive to heat is vitamin C. That is why we say if you want to really get vitamin C from food, always eat raw vegetables and fruits, because once you heat, it's gone. Okay, so vitamin C is very sensitive to heat, and Man, monkey and guinea pigs are the only species requiring vitamin C from their diet because we cannot. These three, man, monkey and guinea pig. What a combination, right? Man, monkey, guinea pigs. These three cannot synthesize vitamin C in their body. So, these three need to get it from the food. So, these are the MCQs from scurvy. Richest source of vitamin C is, don't you know that? Everyone knows. It is our Indian gooseberry or amla. So, that finishes all those 42 MCQs from 2021 FMGE. I hope you got an idea about the important topics, and we also have 2022 left that we'll be seeing in a short while. So guys, we are moving on to the second part of our discussion. I would call this as session 2 of FMGE question discussion, which were the previous year questions from June 2022. And you will see that here I have around 24-25 questions in collection, and you will see that few are like repeat questions, the same topics that we have discussed in session 1, which were the questions from 2021. So, I have a request, those who are watching this, please go back and refer, or else I would request you to start with 2021 and then come to 2022. Otherwise, few will be like grey area, which I'll be just skipping through. Okay, and this exactly is the advantage of discussing previous year question, because a few number of questions will be exact repetition from the previous year exams. So, you just need to go through those topics and you will easily get the answer. Okay, so let's start with the first question, which was a question that we discussed in our last session. Blood bag is discarded in which color bag? And I said, what was the code to remember blood bag and urine bag? Blood is red, it goes to yellow. Urine is yellow, it goes to red. So, blood bag goes to yellow. Instead of blood bag, if the question was like urine bag, then it goes to red, right? This table also we have discussed. So, don't ask me to repeat it once again. Most of the non-recyclable things are going to yellow, right? R is recyclable waste. So, you can remember RPT, rubber items, plastic items and tubes will go to red. And in white, it is translucent bucket. So, you are putting sharps like needles, scalpel, blades, and in blue, you are putting all those metallic implants and broken glasses, ampules, broken vials, all this will go to blue. This we have already discussed. And this session, after all, I need to tell you something extra, right? So, my question is, what will you do with the waste that you are putting in yellow? After all, though we say, see, I said yellow bucket, red bucket, but exactly you are not collecting them in the bucket. Inside the bucket, you have something known as colored liners, like you see here. We are actually, now let's say how to dispose of the waste that you are collecting in these colored liners. Okay. What will you do with the waste that you are collecting in yellow liner? That will finally go for incineration. What do you mean by incineration? You are putting it inside an incinerator and it is burning. Okay. Then what will happen to the waste that you are putting in red? I said these are recyclable waste. So, naturally that will be recycled. I didn't say reused. I said recycled. That means after disinfection, this will be transformed into something else, like for making bags sometimes, for making shoes, so for making road as raw material. So, that is how this will get transformed. Then in white, you are putting sharp waste, right? Which after disinfection will go to sharp pits. Most of the hospitals will have sharp pits behind their hospitals, okay, or behind the building. So, you are putting this in that sharp pit. And in blue, you are putting metallic implants and broken glasses, which will be taken back to the manufacturer, that means to the metal manufacturer and glass manufacturer after disinfection. So, this is the final fate of that waste that you are putting in these colored buckets. Are you with me? Okay. And in most of the hospitals, I would say all big hospitals, they have a common biomedical waste management system. So, an agency will collect these waste and they will be disposing it according to the color coding and according to the rule in a common place. Okay. Moving on to the next question. Identify the image. This was the image given. Is it population cycle or a demographic transition model, disaster management cycle? It is not that cycle. Then planning cycle, it goes round. So, which cycle is this? This is answer B. This is demographic transition model. Now, what is demographic transition model? Can you see birth rate and death rate? So, demographic transition model is a model which shows or which changes from high birth rate, high death rate to low birth rate, low death rate. That transition model from high birth, high death to low birth, low death is known as demographic transition model, and that picture was that of a demographic transition model. So, shift from high fertility, high mortality to low fertility, low mortality with an intermediate period of rapid growth. Now, this model is also known as demographic cycle, right? Demographic cycle is also given by the same model. So, next question we have is from demographic cycle. In a European country, birth rate is low, death rate with no population addition. That means number of birth is reported, no new birth is reported, but deaths are continuously happening. That means death is more than birth. What does it indicate? That means more people are dying than being born. So, even without thinking, you can say population must be declining, right? Because more people are dying than the people who are being born in a year. So, naturally, the size will decline. Now, let's see what are the various stages in demographic cycle. Every country, whether it is developed country or developing country, it has to pass through certain stages in its demographic evolution. You call it as demographic cycle. And these stages are mainly 5 in number. All these 5 stages are together known as demographic cycle. Okay. So, this was the picture that I had shown in the previous MCQ and I am showing it once again. This is demographic cycle. Next MCQ. How many stages? There are 5 stages. Next MCQ. Which are those 5 stages? Stage 1 is high stationary. Stage 2 is early expanding. Stage 3 is late expanding. Stage 4 is low stationary. Stage 5 is declining. Next MCQ. All these stages are described based on the shape of demographic gap. All these are described based on the shape of demographic gap. So, that brings you to the next MCQ. What is demographic gap? Demographic gap is nothing but it is the difference between, or it is a gap between birth rate and death rate when you plot birth and death in the same graph. See, every graph has got a y-axis and x-axis, right? Along the x-axis, you have time here, and along the y-axis, you are plotting birth rate and then, let me take another color, death rate. You have birth rate and death rate along the x-axis. Okay, so this is your x-axis, and this gap is known as demographic gap. So, it is the difference between birth and death when you are plotting both birth and death on the same graph. Next MCQ. When you find the exact difference between birth and death, that means birth rate minus death rate in terms of numbers, what do you call it as? Annual growth rate of a country, right? Annual growth rate. How do you find out the growth rate of a country? By subtracting death rate from birth rate. That will tell you the growth rate. Are you understanding? See, what I am saying is number will give you annual growth rate. Whereas when you plot that in the graph, that difference will give you demographic gap. Are you with me? Okay. Now, let's see how these stages are described using demographic gap. Now, I want you to look at me and listen carefully because we are going to see a lot of MCQs in next 1 minute. Now, what is stage 1? I hope you can see me. you are looking at me and I'm just putting this down and I'm using my hands to show you demographic gap. Okay, so this is your birth rate, this is your death rate, and this gap is demographic gap. Now, what is stage 1? Stage 1 was in pre-industrial era. In pre-industrial era, birth rate was very high, death rate was also very high, but the number of births and deaths were almost equal in number. So, what is happening to the gap? It is stationary, but at a higher rate. This is high stationary. Right? Now, what is stage 2? Stage 2 was in pre-industrial era. In pre-industrial era, what happened was new medicines were discovered, new hospitals opened up, then environmental sanitation improved, communicable diseases came down. As a result of which, what would have happened? What happened? The number of deaths started coming down with number of births going as such. So, what is happening to the gap? Birth going as such, death coming down. So, the gap is increasing. This is early expanding stage. Now, what is stage 3? Stage 3 was in industrial era. In industrial era, what happened? Family planning was introduced. So, people started using contraceptives. As a result of which, number of births also started coming down with further decrease in number of deaths. This is known as late expanding phase. Now, what is stage 4? Stage 4 was in post-industrial era. In post-industrial era, number of births were less, number of deaths were also less, but the number of births and deaths were almost equal in number. So, what is happening to the gap? Gap is stationary, but at a lower rate this time. This is low stationary. Now, what is stage 5? See, you know that there is a limit in decreasing number of deaths. Do you agree with me? That means, see, every second, every nanosecond, a lot of people are dying. So, it is never ever possible to decrease the number of deaths beyond a certain limit, right? That means, it is not possible to take it up till 0, right? But that is not the case with birth. You can bring any decrease in number of birth and you can even take it up till 0, right? This is what is happening in phase 5. In phase 5, the number of deaths are going as such, whereas the number of birth is going below number of deaths. That means more people are dying than being born. So, naturally, what will happen to the population? It declines. This is stage 5 or declining phase. And the question was about stage 5. So, the answer is declining. Are you with me? We have discussed, I would say, some 6-7 questions in this 1 minute. Hope you have followed. If you have any doubt, you can always ask me. I have some pictures as well showing stage 1, stage 2, stage 3, stage 4. I don't have a stage 5 picture, but you can guess, right? Okay. Next question. All healthcare providers are working at village level except. Let me take my pen back. Except. Are you thinking? The answer is A&M. Where is A&M working? By the way, who is an A&M? A&M is multi-purpose worker. A&M is multi-purpose worker. Where is he or she working? We have multi-purpose, we have A&M is a she only, but multi-purpose worker could be a male or a female, and they are posted in sub-center. They are working in sub-center. Sub-center is part of our health system. It is not at the village level, right? It is coming right under the primary health center. Next MCQ. What is the population of a sub-center? It is 5,000. And under PHC, how many sub-centers are coming on an average? 6 sub-centers under 1 PHC. Next MCQ. Then what will be the population of 1 PHC? 6 into 5,000, right? 5,000, 5,000, 5,000, 5,000, 5,000, 5,000. So, that will make it 30,000. So, the population of 1 PHC is 30,000. Are you understanding? Next MCQ. Who is the person who is posted in a PHC? Of course, MO. I am not asking about MO. The field worker. That is health assistant. Health assistant. The other is multi-purpose worker. This is health assistant. One health assistant is in one PHC. So, what will be the population catered by one health assistant? 30,000 population of that of a PHC. So, we have discussed all MCQs from A&M. Now, let's see one or two MCQs from others as well. What is AWW? Anganwadi worker. Okay. And she is working at the village level. She is coming under which program? She is coming under ICDS program. Right? What is TBA? Traditional birth attendant. Traditional or trained birth attendant. And trained birth attendant is also known as trained DI. Right? And Asha is also from the community. She is working at the field level. Full form we have already seen. Asha, accredited social health activist. And we have also seen what are the criteria for selection of Asha. And one Asha is for 1000. And we also learned about Usha for urban area. Go back and refer. Okay. So, I am not going to say that again. Hope it is okay. I know even if one or two are asking me to repeat it, the majority wants me to go through the rest of the slides because you have an attention span. You don't want to, I don't want you to stretch your attention span beyond a particular limit. That will be disastrous. All facilities provided CHC except CHC is community health center. A specialist present like surgeon. That is true. CHC is big. CHC is for a population, we have seen subcenter is for 5,000. PHC is for 30,000. One CHC is for, that is the next MCQ. After that, we will come to the answer. For 80,000 to 1,20,000. That is also an MCQ. A specialist like surgeon should be there. Specialist should be there. Blood storage facility. Yes, should be there. What is a surgeon going to do without blood storage facility? First referral unit. That is also correct. From PHC, the first referral unit is CHC only. Intensive neonatal unit. That also should be there according to the latest IPHS standards. Indian Public Health Standards say that there should be an intensive neonatal unit in CHC. Whether we have it or not is a different question, but as per the guideline, it should be there. So, the answer is none, because all these should be there in a CHC, ideally, as per guideline. If you don't see this in a CHC, don't ask me why it is not there. It has to be there. In measles epidemic, 7-month-old child was given measles vaccine. When should the next dose of measles vaccine to be given? See, I have a question. Is it possible to give measles vaccine during 7th month? Ideally, should be given after 9th completed month, right? After 9th completed month. That is the ideal time, right? But it is also said that if there is measles outbreak and the child is getting exposed to measles outbreak, then he can be given vaccination after 6 months. Any idea what is the rationale behind 6 months? Up till 6 months, mother's antibody will be there in child's blood. So, that will give protection. After that, there will be a, decrease in the antibody and immunity also will come down. So, between the 6 months and 9 months, if there is an outbreak, there is a chance that the child would have got exposed. Then, you can give 1 dose of measles. So, in this particular situation, measles vaccination is given at the 7th month. Now, the question is, when will you give the next one? The next you can give at 9th month. Like this, that means this extra dose you have to count as 0 dose. Don't count on it. Don't consider it. Just give the next dose like you are giving as per the national guideline. Provided there is a 4-week gap. Provided there is a 4-week gap between that first and second dose. Are you understanding? After that, you continue the schedule. That's it. Is it clear? And I am not going to tell you what the schedule is. You know that, right? Next is given between 16 to 18 months. Then every 6th month, 2 lakh up till 5 years, which we have already discussed. Don't ask me to say it again. So, in this particular question, age can be lowered to 6 months if there is a measles outbreak, and if a child is immunized between 6 months and 9 months, then second dose should be administered as soon as possible when the child reaches the age of 9 months with 4 weeks gap. Moving on to the next. This is from family planning. What is the content present in the given contraceptive image? Are we able to see it? This is today. What is today? Today is vaginal sponge. And what is the content in vaginal sponge? This is a repeat question, you know. Nonoxynol 9. Nonoxynol 9. And LNG, what is LNG? Levonorgestrel. It is a main component in which one? E-pill, emergency contraceptive pill. Doses 1.5 milligram. Next MCQ, how do you give it? It should be given within 72 hours. Okay. Ethinyl estradiol. This is the content you have in OCP or combined contraceptive pill. Doses 30 microgram along with progestogen. Okay. So these are the MCQs from others. Now let's see a few more MCQs from today. This is an image-based question. Have you seen vaginal sponge? If not, have a look at this. This is how vaginal sponge looks like. It's so soft and sponge-like. Can you see? That is why we call it as vaginal sponge. And today is the brand that is available, widely available. It contains 1000 milligram of nonoxynol 9. Now, how to use it? It is a spermicide. So, this vaginal sponge will be coated with this spermicide. To activate it, it has got surfactant action. To activate it, what you have to do first is, you have to put drops of water, clean water. Then 2-3 drops of water. So, it will become wet. Then you squeeze out that extra water and then you can insert it inside the vagina. And you will see a loop like this, which will be hanging out. So, after intercourse, you can take that sponge out using that loop. You can just pull it out. Are you understanding? This is how it works. Moving on to next question. After 6 weeks delivery, P1 L1 female desires contraception for at least another 3 years. She wants a minimum gap of at least 3 years. Which one is the best option? For long term, the best would be 2. Which are they? OCP and copper T. And out of these 2, which one do you think is the best? OCP has some problems. What is it? Especially the lady is in her 6th week. That means she is feeding the baby. So, better to go for copper T, which is a best option. The question is, best option is copper T, because that will give protection for, if it is copper T 380A, 10 years. If it is copper T 375, 5 years. Okay. So, the best is copper T. And you know why OCP is not the answer? Because she is breastfeeding the baby, and in breastfeeding, OCP is not good. Then timing for IUD. These are again MCQs. Ideal time or the best time is during or within 10 days of menstruation. Why? Because you are sure, during menstruation, you are sure that she is not pregnant. Moreover, the cervix will be dilated, so it's easy to put copper T. Then immediate postpartum, during first week of delivery, before she leaves the hospital. That is the best time to catch her. After going through a lot of trauma, she will be so receptive to contraceptives. Then post-puerperal insertion, that means during puerperium, 6 to 8 weeks after delivery, when she is coming for the follow-up. At 6 weeks, she comes for follow-up, right? For giving the first vaccination of baby. After abortion, only after 12 days you have to give, because the uterus has undergone a lot of trauma, a lot of injury will be there. Then post-placental. We have something known as post-placental. Do you know? 10 minutes after delivering placenta. That is also there. Now I am going to tell you another one. Intra-cesarean. This is also there, given in our PDF, which is there in the Ministry of Health and Family Welfare site. We have after delivery, after delivering placenta before closing the incision. Intracaesarean copper T insertion is also there. So, see, these are the timings for IUD. So, you can also expect a question like which among the following is not a correct timing for IUD insertion. So, you know which are the correct timing. So, the one which is not coming under this is or will be the answer if you are getting such a question. Next is maternal death according to WHO is. We have seen this in the previous session or session 1, 2021 question. Maternal death is a pregnant lady dying while she is pregnant or during the time of delivery or after delivery for 6 weeks or 42 days. So, the answer is which among this? Is it A, B, C, D? Antenatal to 6 weeks after delivery. That is the answer. And the question that we have discussed was MMR. Full form of MMR is maternal mortality ratio. Okay. And this we have already seen. So, allow me to skip this slide. Go to 2021 and please refer. We have seen. If counseling and screening for TB in a HIV patient is done in an ICTC clinic as per NACO guideline, which is that level of prevention? By the way, which are the levels of prevention? 4 in number, right? Primordial, primary, secondary, tertiary. So, screening is coming under. By the way, what is the question? An HIV patient coming in ICTC. What is ICTC? Integrated Counseling and Testing Center. That is where we are diagnosing HIV, right? Okay, so an HIV patient is undergoing screening for TB. Which level of prevention is that? Screening is coming under. If you have gone through my original video, you know that S and S. I said screening is coming under secondary level of prevention. So, the answer is secondary because you have S here, S here. That is not the reason because you have S in both places. I have just given this as a method to link or to remember it during the exam. Now, let us see what are the levels of prevention and what are the modes of intervention. By the way, there are 4 levels of prevention. I will not be going into the details. We have primordial, primary, secondary, tertiary. What is primordial? Primordial means how does a disease starts after all? First you have risk factors, then after risk factors, after interacting with the risk factor, that means after the interaction of man with the risk factor, disease develop, then the disease progress, go for complication and finally some outcome, right? So, primordial means you are trying to prevent the emergence of risk factors. Suppose you failed there, what happened? Disease will come up, right? So in primordial, you are trying to prevent the emergence of risk factors. In primary, risk factors have come up, but you are trying to prevent the emergence of disease. Then you have secondary and tertiary, both you are applying after the disease develops. Then what is the difference? That means both secondary and tertiary you are applying in the, I would say, pathogenesis phase. That means once pathogenesis starts. Whereas primary, that is the next MCQ, that's all looking blue. So, let me take red here. Primary is given in the pre-pathogenesis phase. That means before the disease develops, you are trying to prevent the emergence of disease. After pathogenesis or once disease starts, you have secondary and tertiary. Then what is the difference? Pathogenesis phase is again divided into early pathogenesis phase and late pathogenesis phase. Early pathogenesis phase means the disease has just started. So, the patient is still in the reversible phase. Okay, early means just started. So, there you are doing screening to diagnose the disease at the earliest and you are starting treatment. Late means it's already late. That means the patient is already in the irreversible phase. So, you will not be able to bring him back to a normal life. What you can do to the maximum is you can prevent further disability and you can give some rehabilitation. So, let us see what are the modes of intervention. We have already discussed some modes of intervention. Modes means what are the activities that you can do under each of these levels of prevention. So, primordial, you are giving mainly health education, right? So, by educating people, you are trying to prevent emergence of risk factors, asking them to take good food, avoiding all those unhealthy behavior. Then, in primary, We have two. I'm not going into those details. Please do remember this. If I had time, I would have told. It is health promotion and specific protection. Example 4, specific protection is vaccination. That means you are specifically trying to protect from one disease. That means giving vaccination, vitamin A prophylaxis, which were previous MCQs. Secondary, we have already seen screening, early diagnosis and giving treatment so that you can bring the person back to a normal life. Tertiary also we have discussed, which is disability limitation and rehabilitation. Each of this cell is an MCQ. So, let me just highlight levels of prevention, definition, modes of intervention. Each of this is an important MCQ. Shall I move on to the next? This question is from health communication. In the last session, if I remember correctly, we have seen 1 or 2 questions from health communication. It's a small chapter but important chapter. 4 to 8 speakers interact in front of a large group of audience. In the last session, the questions were from demonstration and also from focus group discussion. Okay, so here it is 4 to 8 speakers interact in the form of a large, it's not from, in the form of a large group audience to talk about a topic. There is no agenda, that is the keyword, no agenda, no set speeches, no order of speaking. At the end, there is an interaction with the audience. So, what is it? It means 4 to 8 people are simply sitting on the dais and they are discussing about something. They are simply discussing. There are no set speeches. They are coming and they are just discussing about it. So, this is panel discussion. So, in panel discussion, as you can see in this picture, there will be a group of experts who are panelists and there will be a group of audience as you can see here. And the discussion will be on one particular topic. And here, there will be one moderator who moderates this discussion. And the most important thing that you have to remember in panel discussion is there are no set speeches. One person will simply start talking, followed by another person, followed by another person. Sometimes there will be side conversation and it is a duty of the moderator to see that the discussion will proceed in a productive manner. Okay, and finally, the audience can also ask questions. This is panel discussion. So, why this answer was panel discussion? Because there are no set speeches. And like I said, there will be a chairman or a moderator. Whereas in symposium is also very, very similar to panel discussion. You have a group of experts sitting on the dais and the discussion will be on a common topic and it will take place in front of a group of audience. Now, how is it different from panel discussion? In panel discussion, I said there are no set speeches. They are simply coming and talking. Whereas in symposium, these people will prepare and present using some audio-visual aids, a part of the topic being discussed. Is it clear? Suppose there is a talk about monkeypox. One person will prepare and present about the epidemiology of monkeypox, another person about the preventive measures, another person about how to treat monkeypox, another person about the clinical features. So, that is symposium. Now, let's see the other MCQs from symposium. Series of speeches on a selected subject, expert present, an aspect of it, no discussion among the members. This was a previous MCQ. No discussion among the members is coming under, is it panel discussion or symposium? It is in symposium. They simply present, come and sit. Now, next person will go, present, come and sit. There is no discussion among the members. Whereas in panel discussion, they are discussing among themselves. And audience can also raise question at the end here as well. Is it clear? True statement with respect to population pyramid is, what is population pyramid? We'll see that. First, you answer this question. As the height increases, life expectancy decreases. It's the opposite. As height increases, life expectancy increases. I'll tell you why. Base denotes fertility. This is a true statement. Base denotes fertility. That is true. Broad base means number of working population is more. No. Broad base means more of children. Middle part indicates male-female ratio. No. The sides indicate male-female ratio. Now, I'll show you. population pyramid. This is population pyramid. Okay. As you can see, population pyramid, also known as age pyramid. That is another MCQ. It is also known as age pyramid. So, as the name indicates, this is a pyramid-like structure, or this is a graph in which various age groups in the population are arranged in the form of a pyramid. Okay. So, you have a y-axis and an x-axis. Along y-axis, as you can see here, you have the age groups arranged at an interval of 5, like 0 to 4, 5 to 9, 10 to 14, like that. And along the x-axis, you have percentage of population falling under each of this age group. Are you with me? Towards left, you have data regarding males, and towards right, you have data regarding females. Is that clear? Now, hope you are understanding. This is the population pyramid of India as of 2006. This means that in the year 2006, in India, in the age group of 0 to 4, there were around, say, 6.2% of males, whereas there were only 5.8, around 5.8% of females in the age group 0 to 4. This is how you read population pyramid. Now, you can tell me what are the uses of population pyramid. One is, you can find out sex ratio, right? Males on one side, females on, so age-specific sex ratio is possible. Then, what do you have in the base? Children. So, that denotes the shape will tell you about the fertility. What about the height? Height means y-axis. What do you have along the y-axis? Life expectancy. So, as height increases, what does that mean? Life expectancy is more, right? And where are you getting the working population? They are coming in the middle. Okay. And then you have old age population here and young age population somewhere here. So, that will tell you about dependency ratio. So, these are the uses of population pyramid. Is that clear? Hope you are with me. Association between social factors and disease causation is described by association between the factors which lead to disease. What do you call it as? How different factors in the body, micro changes which are happening inside the body leading to disease, you call it as pathology, right, or pathogenesis. So, naturally, the social factors leading to disease is known as social pathology. So, what is social pathology? It shows the relationship between how the social factors are affecting health. By the way, what are these social factors? You call these social factors, that means factors in the society which can lead to disease as social problems. And 3 important social problems which can cause disease are shown in this picture. Which are those social problems which can lead to disease? One is, yes, substance abuse, then alcoholism, then this is IV drug abuse, then smoking. These are social problems or risk factors in the society which can lead to disease. Don't you agree with me? All these can lead to disease. Majority of the patients we see in hospital are coming with these problems, right? Okay. And when it comes to social problems, not just these 3, poverty, illiteracy, then juvenile delinquency, suicide, rape, then casteism, child marriage, all these have got some stake in health, right? All these are social problems, and if you're studying the relationship between social factors or social problems and how they are affecting health, it is known as social pathology. Okay. Next question. Relative risk is estimation from. If you had followed the first session, you can easily answer. Relative risk you get from cohort study, right? So, I said in cohort study you are getting incidence. I won't write it, we have already seen. Cohort study you will get incidence, relative risk, attributed risk and population attributed risk. From case control you will get which all? You will get odds ratio. From cross sectional I said you will get prevalence, and the example is survey. And from RCT you will get intention to treat analysis and effectiveness of a drug or medicine, right? Now, I am going to give you 2 extra MCQs which you would be knowing already. One is case, which among this is retrospective study? It is case control. Case control is retrospective study because you are taking deceased and non-deceased, and you are asking them about their exposure in the past. Cohort study is prospective study. These are two extra MCQs which I was planning to deal in second session. If I give all the MCQs in one session, it will be too much for you, right? Even now you might be thinking it is too much, madam. While working on a machine, a person lost both of his hands. Due to this, he is unable to write and lost his job. Identify the most appropriate term for this condition. It is, he lost his job. He is unable to go for work. So, the answer is handicap. Sorry, disability is not the answer. The answer is handicap. This is the answer, guys. Okay, handicap is the answer. Answer is D. Shall I write? Answer is D. That was a mistake that somehow C came as the answer. Answer is D. Because he lost his job. This is the key term which helps you to identify the correct option. Okay, now let's see what are these. There are 4 terms. One is disease, impairment, disability and handicap. Now what is disease? Disease means some malfunctioning of body, some disease. As in the case of, I'll give 2 examples. One is diabetes mellitus and the next is polio. Now disease will lead to impairment. Now what do you mean by impairment? Impairment, word meaning is losing something. Losing what? As the name indicates, in impairment you are losing something. What? Either an anatomical structure, as in the case of diabetes mellitus, amputation, or a physiological function, as in the case of polio. The patient has leg but he is unable to use it. Losing anatomical structure or physiological function. He is getting paralyzed. Right? Now, impairment will in turn lead to hand disability. What do you mean disability? As the name indicates, disability means inability to do a routine function which is normal for a person's age and sex. So, because of this impairment, patient is unable to walk. So, this will lead to inability to walk. He is not able to do a routine function which is normal for him. Okay. Now, disability will in turn lead to handicap. Now, what is handicap? This has got an extra dimension. Because of this disability, the patient is unable to do a social role. His inability to do a job, to do a social role. I am saying a social role which is expected out of him. So, here if this person is the only breadwinner of the family, then what is his social role? He should be able to go for job and earn a livelihood, which he is unable to do. Are you understanding? So, here the question was, patient lost his job. That means he is unable to function, do his role. So, the answer is handicap here. And next MCQ is, what is the order in which these 3 are, sorry, not 3, these 4 are arranged? It is disease, followed by impairment, followed by disability, followed by handicap. That is also an MCQ. Are you with me till here? Hope you are following. If you have any doubt, you can ask me. Which indicator is used for comparison between 2 countries' life expectancy? Life expectancy is compared under HDI. What is HDI? Human Developmental Index. HPI is Human Poverty Index, which we are not using nowadays. DALY, we have already seen what is DALY in the last session, and DFLE also we have seen. I said Sullivan's Index. So, these 2 are 2 disability indicators that we have seen. These 2 are 2 disability indicators, right? Now, let us see what is HDI, and whenever you discuss HDI, it is discussed along with one more term, PQLI. What I am going to show you here, what I am showing you here are MCQs from PQLI and HTI. Both are very, very important questions for your exam. What is PQLI? Physical Quality of Life Index. What is HTI? Human Developmental Index. Okay, it is Human Developmental Index. Wait. Okay, it is Human Developmental Index. Now, in PQLI, Physical Quality of Life Index, as the name indicates, you are trying to measure the quality of life of people residing in a country. And when you are measuring the quality of life of people residing in a country, three important factors which determine the quality of life are IMR of that country, then literacy rate of that country, and life expectancy at 1 year of that country. Okay. And HDI is Human Developmental Index. Now, what do you mean by development? As the name indicates, here you are measuring the development. And for development of a country, the most important thing that you need is money, right? So, there you are measuring income of that country, knowledge of that country, and life expectancy at birth of that country. Is it clear? So, we can remember PQLI as ill and HDI as kill. Ill is IMR, literacy rate, and life expectancy. Kill is knowledge, income, and life expectancy at birth. Now, if you use this kill and ill, the answer will automatically come to your mind. Okay, PQLI, LI, LI. So, something starting with IL, L, that way. But even then there can be a confusion because life expectancy at 1 year, is it coming under PQLI or HDI? Actually, there is no need for confusion because IMR is infant mortality rate. So, life expectancy up to 1 year, infant is 1 year, right? So, up to 1 year is already covered under IMR. So, there you are starting life expectancy from next year onwards, whereas here I is income. So, you are starting from birth onwards. Next MCQ is regarding the range. The ranges, it changes from in PQLI 0 to 100 and in HDI 0 to 1. Again easy. When you compare PQLI and HDI, which has more letters is for PQLI. So, PQLI is more lengthy and the range is also lengthy. HDI is short, range is also short. Hope you are able to relate with what I am saying. That is my assumption that, okay, you are following the way I am thinking. If you are unable to do that, always you can ask that doubt. Whenever you come across any doubt, you can ask me. This video will be available in YouTube till your exam. So, you can just in the comment box, you can ask doubts. Vaccines given at birth to a baby are 0 dose given for BCG, OPV and hepatitis B. Is it not? Yes. Next MCQ. BCG should be given at the earliest and can be given up to 1 year of age. That means after 1 year, if the child is coming, there is no role for BCG at all. Because this is important as you can expect question like an unimmunized child is coming at 1.5 years. Which of the following can be given? Don't give BCG because there is indication for BCG only up to 1 year. Then coming to OPV. The question is about OPV 0 dose. That means the first birth dose can be given up to 15 days. You know when all we will give OPV, right? 6, 10, 14. That I am not talking about that. Here it is about 0 dose. 0 dose can be given up to 15 days. That means birth dose. And what about hepatitis B? It should be given within 24 hours. These are also MCQs. Moving on to 18th question. When is the first dose of hepatitis B vaccine given to neonate? Same question in 2 different forms. At birth, up to 24 hours. All tests done before blood transfusion except, don't you know, if you have ever given your blood, if you have ever acted as a donor, then you must be knowing which are the transfusion transmissible diseases which are or transfusion transmissible infections, you call it as TTI, transfusion transmissible infections which are being screened. Hepatitis B, hepatitis C, HIV, syphilis and malaria. So, the answer is hepatitis A. Now, hepatitis A is not screened. It is not getting through, you are not getting hepatitis A through blood. It is a fecal-oral transmission, right? So, the donor blood, which are the TTIs? That is a question. Which are the TTIs that are being screened? HIV, HPSAG, VDRL, malaria parasite, HCV, along with blood grouping. That also will be done free. Okay. Best measure of central tendency for skew data. Too high and too low values are present in community. Wide range of values reported in a community is measured by. The question is, in a skew data, which is the best measure of central tendency? In a skew data, which is the best measure of central tendency? By the way, what do you mean by skewed data? Skewed means non-normal distribution. Okay, non-normal means you will be having a lot of abnormal values, or I would say some extreme values. If extreme values are present, then the best measure of central tendency. What do you mean by measure of central tendency? By the way, which are the measure of central tendencies? Let me start with that. Which are the measures of central tendency? First MCQ. You have mean, median, mode. All these are averages. On an average, you say on an average, right? So, these are averages which has a tendency to lie at the center of a big data set. Okay. So, these are the methods by three methods by which you can find out averages. Okay. Now, in a normal distribution, the best measure of central tendency is mean. So, mean is best for normal distribution. In a normal distribution, the best measure of central tendency is mean. In a abnormal distribution, now what do you mean by abnormal distribution? Also known as skewed distribution. When do you get skewed distribution? When you are having a lot of extreme values in the data set, then the best measure of central tendency is median. So, in a skewed distribution, the best measure of central tendency is median. So, that was your question. By the way, what is median? Middle value, the value which lies at the center. Mean is, add all the observation divided by number of observation. Now, what is mode? Most commonly occurring value, or most commonly or most frequently repeated value. Repeated value. All these are again MCQs. In normal distribution, which is the best measure of central tendency, in skewed distribution, and which is the most commonly repeated value. Hope you are with me. I am just thinking what will be your state of mind right now. Okay, and standard deviation is a measure of dispersion. Okay, that also I will write for your sake. Standard deviation is measure of dispersion. It will tell you about the spread of values in a data set. On an average, how much is the spread of individual values around the central mean. People went for camping for a week. Best method of disposal of waste. If you have gone for camping, you know. What do you do? Best is bury, don't dump. What you do must be dumping, I guess. That is not the scientific method. Composting needs a long time, so you can't go for it. Manure pit, do you think it is possible to make manure pit where you are camping? Only thing is deep burial. Dig, then put the waste, cover it. Okay. Then a 30-year-old man is presenting with chief complaints of diarrhea, breathlessness and knee edema. He reports that his family eats food which was cooked with mustard oil. Identify the condition. So, here the key points are, one is patient is coming with diarrhea, breathlessness, knee edema. That means, some symptoms which is suggestive of something. I will come to it. He also says that family has eaten food which is cooked with mustard oil. Once you see mustard oil and family eating, always think about some food poisoning or food toxin. So, which is that food toxin that is transmitted through contaminated mustard oil? That is epidemic dropsy. Okay, epidemic dropsy. So, which are the other food toxins you know? A very commonly asked question is about what you see here is, what do you see here? This is kesari dal. See, both are not kesari dal. One is normal dal and the other normal moong dal and the other is kesari dal. They look so similar that they get mixed up and it leads to lathyrism. And next MCQ, so lathyrism is caused by kesari dal. Next MCQ, which is the toxic principle? It is BOA. That means beta oxalyl aminoalanine. That is the next MCQ. Moving on to epidemic dropsy. See, remember drops, I'm just trying to help you here, okay. Drops are caused by water and oil, right? Drops are caused by oil and water. Keep this in your mind. So, in epidemic dropsy, here the culprit is an oil. Which oil? It is argemone oil, which contains sanguinarine, that is getting mixed up with mustard oil. That was the question. Okay. So, here argemone oil, this is the culprit. It is getting mixed up with mustard oil and argemone oil contain sanguinarine. So, these are MCQs. Okay. So, oil drops. Dropsy means think about caused by an oil. Then what is the role of water here? Mainly the manifestations will be that of water retention because there is proteinuria. I am not going into those details. This is argemone mexicana from which this argemone oil is derived. So, clinical features are like that of water retention, swelling of leg, diarrhea, glaucoma, cardiac failure leading to breathlessness and such things. Those were the symptoms, right? Those were the symptoms here. So, bilateral pitting edema, these are the manifestations. So, dropsy, the MCQ is think about oils and water. Manifestation as water retention caused by oil. Now, there is endemic ascites. So, ascites starting with A. So, it is caused by an alkaloid. So, A and A. It is caused by an alkaloid which is derived from Crotalaria seed. What you see here is seeds of Crotalaria and the alkaloid name is pyrrolizidine alkaloid. Okay. And ascites means, you know, it is hepatotoxic. So, naturally, the manifestation will be in the form of ascites. And in the last session, we discussed about St. Anthony's fire, which is ergot poisoning, which I will not be discussing again. Did you follow till here? These toxins we didn't discuss in last session, but there we have discussed few other toxins. So, please go back and read. Question number 23. People of a community are consuming kesari dal for last few years. Naturally, that will lead to lathyrism. Now, the question is, lathyrism prevention step in community are all except. What do you think? Banning of crop. Yeah, that can be done. That should be done actually. Vitamin C prophylaxis. There are some studies which shows that if you continuously give vitamin C prophylaxis, that can prevent to a certain extent lathyrism. Toxin removal. Yes, there are different methods by which you can remove toxin from kesari dal. That BOA can be removed. Now, what about DEC? By the way, what is DEC? This is given for prophylaxis of filariasis, right? You are giving it as MDA, mass drug administration, which has nothing to do with lathyrism, right? That has nothing to do with neurolathyrism. So, let's see what are the steps for preventing lathyrism. One is vitamin C prophylaxis. Second, banning of crop. Then, removal of toxin by either steeping method or parboiling. Steeping means you are soaking the pulse, that is kesari dal, in hot water and then drying it. Parboiling is also something similar where you are using lime water overnight and then you are assuming that it is getting destroyed. So, you are using it after drying. Education of the people. Ask them not to eat that thing. Genetic approach. So, they say kesari dals which doesn't have toxin can also be genetically manufactured or engineered. Socio-economic change. People are eating this because they don't have anything else to eat. That is why they are eating this toxin. So, you change their economic status. That also could be done, right? So these are the preventive measures for lathyrism. And I think this is the last question. Which nutrient is deficient in breast milk? Something similar we have discussed in last session. Which nutrition is, or nutrient is deficient in breast milk? It is vitamin K, right? Because I said children are born with less reserve of vitamin K. Vitamin K is synthesized inside the body from gut bacteria, and children don't have, infants, small children, neonates don't have gut bacteria, because of which we are giving vitamin K injection. That was the question. Okay, so we have finished a lot of questions. I would say 66 questions from 2021 and 2022. Hope you have followed, and I hope you have found this session useful. And if you have any doubts hereafter, I will be available and I can give you my number. My number is 9895449210. This is my number. This is my WhatsApp number. Okay, you can contact me through WhatsApp in this number. I'll be available for your doubts, doubt clearance. And another way to get in touch with me is through Telegram or through the video. See, this video, I suppose, will be available in YouTube till your exam. Okay, and while going through this, if you have any doubt, just ask in the comment box. I'll try to get back to you. Okay, so guys, thank you very much for your patient listening, if you were listening to it till the end. And I hope this was useful and this will be beneficial for your exam as well. So all the best. Stay confident, stay cool, and definitely you all will get through this exam. And community medicine part is going to be very, very simple for you. And it's mainly common sense that you need to apply a little bit in community medicine. So good luck and all my prayers. Bye. Thank you.